after you have performed your manipulation or your home exercise program, or if you have unlocked a sacroiliac joint and then the sacroiliac joint is found to be hypermobile, positive straight leg raise or positive Vorlov test for instability, you may want to use a SI lock, a sacroiliac belt. If the patient is mostly unstable, didn't lock, the main problem is instability, we're usually going to choose to place the belt in a nutated position, which is more a stable position of the sacroiliac joint. Nutation is more reliable in the weight bearing. So if I treat the right side, I'm going to ask the subjects to weight bear, position most of the weight on the right leg, keeping the left leg on the floor, and then I'll position my belt. So the middle of the belt here is on the sacrum, on the back here on the sacrum. Be sure that when you position the belt that the subject has like cotton type clothing, otherwise it'll slip up as they use the belt. Now, for the position of the belt, you need to be the belt. Now, for the position of the belt, you need to be there's two different type of position. You can have a belt that's at the level of the ASIS, just underneath the ASIS, or you can position the belt just above the greater trochanter. If you put it just above the greater trochanter, is more if you suspect with a sacroiliac joint affliction, if you also suspect a pubis symphysis instability, higher just for the sacroiliac joint. Then in that position, you're going to pull on the belt. How much do you have to pull on the belt? About the pressure, so you can about pass a couple of fingers underneath the belt. For the comfort of the patient, you may also want to bring the plastic element of the middle. You may want to place it in the on the side of the patient as you put the belt on. That's for a use of the belt in a more nutated position, to more a stable position. If that doesn't work, the patient cannot tolerate it, we can ask the patient to lay down in the supine position with the legs on the floor. You also can put a pillows underneath the knee if you do it in the neutral position. So if you want a neutral position, more comfortable for the patient, then again the belt underneath the ASIS. Here with the belt and the plastic element being a little bit more on the side. Tightening of the belt, put about 2 fingers, tighten the belt. Here. So in this position, it would be a neutral position. Here more for the sacroiliac joint. Just above the greater trochanter would be more if there is a symphysis pubis involvement. And then if you want to promote counter nutation, a patient, for example, that would have a tendency to be unstable and lock in a nutated position, you want him to lock all the time in a nutated position, then you can position the patient again in the supine position without a pillow underneath the knee and position the belt as indicated before. How long do we use the belt? We suggest that the belt is held by the patient at least for 23 hours a day, or as long as they can tolerate it. And usually the use of the belt is encouraged for a period to up to 6 months or more.